Let's have this discussion now. June has been designated by the World Health Organization as Men's Health Month. It's an awareness campaign to encourage early detection and treatment of diseases that affect boys and men. However, on average, men tend to be less likely to consult a medical practitioner than their female counterparts. Today, we focus on all things related to men's health, including reproductive health. Let's bring in our guest, Dr Shingai Mutambirwa. He heads the Urology Department at the Sefako Makgatho Health Sciences University and joins us now via our video link. Doc, great to see you. Thanks very much indeed for making time for us. Let's start with the broad issues before we hone in. It feels as though, anecdotally speaking, men are typically more reluctant to take contraceptives than women. In a context, there's an expectation for women to do it. Why do you think that's so?
Well, I think a lot of the data actually shows that guys are actually quite keen on using contraception. But the biggest problem for guys is that they have a lot of other aspects, including the psychological aspect, that they would prefer the female partner to, if they are in a heterosexual relationship, to actually make that attempt. The second big problem, though, is that for guys, we haven't got that many different types of male contraception. Females do have a lot of more options, including the loops inside the vagina, the hormones and things like that. But for guys, it's essentially only 3 things that are currently approved for contraception. That would be condoms, which have got also other benefits, of course, including preventing STIs and things. Withdrawal method, which isn't very effective because you're probably only looking at about 40% chance that you're not going to make your partner fall pregnant. And then the third one is what we call a vasectomy, which is essentially tying off the tubes that come from the testicles that bring the sperm towards the tube, the pipe for passing urine, which is also the pipe for ejaculation. But going forward, I think there are some good data to show that we're actually, with the advent of new options for men, guys may be more proactive in actually taking care of their contraceptive health.
Yeah, it's very interesting because, again, the general stereotype is that men are actually a whole lot more, call it, risque in their sexual behavior, and the expectation would be that there needs to be a whole lot more responsibility placed on them to ensure that there aren't, call it, unintended consequences.
That's true. I think one of the issues also is that a lot of guys think that if they do make somebody fall pregnant, the female can also still take post-coital contraceptives, or they can have an abortion, or they don't have to take care of the children. So I think it's important for guys to recognize that it's an equal. If you're looking to maintain your fertility, you must make sure that you're actually also responsible about how you take care of your health. And as I said, with the options that we have, they work very well for the majority, at least for the condoms and the vasectomy. But I think also going forward, with the newer male pills and things that are coming out, we should be able to have even greater management of our own contraception activities. Yeah.
I mean, you're in the field, so perhaps you'll give us a better picture. Why is it taking so long to have some kind of pill for men? Am I missing something?
No, it's just remember that females, when they're born, they have a limited number of eggs, and they produce 1 egg a month. That can be managed by hormonal management and for various other things. But for guys, the problem is that we've been trying to get a male pill in inverted commas for many years. But unfortunately, it's just difficult to actually make sure that it is safe and also can be reversible, because that's the biggest issue, more about reversibility. So I've got now some injectables and things that are being used to try to suppress it. The problem again is the reversibility, so we've been battling a little bit with that. There are on the horizon things like, for example, that can make the sperm not swim so well, and those can be used. And then we're also looking at reversible blockage vasectomies, essentially, where we can reverse the blockage in the post injecting things into the tube that carries the sperm up to the prostate. But it's still a little bit difficult, and unfortunately, we're only probably going to get these contraceptives maybe in the next 5 years or so.
Sure. I wonder whether it's possible to even have a discussion around how men are responding to their health without speaking about the surrounding issues. For one, are you finding that, for instance, socioeconomic background is a factor of whether or not a man takes an interest in how healthy they are?
Oh yes, definitely. We know that the socioeconomic status and the literacy has a huge impact on whether people are going to actually take care of not only the general health, but even their sexual health.
Yeah.
And for example, even if when you're looking, for example, at condoms, they can be very expensive as well relative to the person's income. So I think as part of the government service, we are now trying more and more to actually encourage men's sexual health to improve. We're trying to make sure that their general health improves, because we know that even when it comes to, like, for example, diet, which can affect your fertility as well as your general health, the lower your socioeconomic status, the more likely you're going to be eating foods which are unhealthy, which can also impact on your general health and your sexual health.
Yeah. In most circles, I wonder if we are even able to address what I think are the root causes for this discrepancy between how women and men generally respond to their health, without necessarily having a conversation about what it means to be a man. I mean, am I going too far, or do you think there's something to be said about that?
You're completely correct. I think, well, like you said earlier, guys are more likely to die earlier than females. They're more likely to take risks. They're more likely to smoke. They're more likely to take aggressive things, which actually impacts on our longevity. So we know that, for example, females who see their healthcare providers 5 times more in their life than men for various reasons also have about a 6-year longer life expectancy, mainly because of the changes in the fact that females are taking better care of their health. And I think guys need to start recognizing that we need to be proactive in what we're going to be doing to take care of our health. And if you fail with that, it's actually going to impact also on your sexual health, which is really where contraception, and that is also important. But even just for erections and things like that, because the point is, if you don't take good care of your general health, you're going to be battling in the bedroom as well.
Sure. Really some sobering things to think about. Thanks very much indeed for your time. Really appreciate your insight this morning. Dr. Shingai Mutambirwa is a urologist, in fact, head of the urology faculty at Sefako Makgatho Health Sciences University.